Hi, I'm Dr. Weiner, and I'm going to talk to you today about Cellfina. Cellfina is a long-term solution to cellulite. We have not had any long-term solutions to cellulite up to this point. Before we had treatments that took multiple treatments, up to like 10, and they lasted for a few months. Well, Cellfina is actually studied up to 3 years now, and it's going to be longer, but we have 3-year data that shows that it lasts for 3 years. And the satisfaction rate at 2 years is around 96%, and at 3 years is about the same. So we have a long-term solution with one procedure with minimal downtime with Cellfina. So let me go over here and discuss what cellulite actually is and what Cellfina does. So we'll pan over here. And so what we have here is a diagram of cellulite. And what cellulite dimples are caused by are this fibrous tissue right here pulling down on the skin and creating that dimple. So what Cellfina does is it comes on in and it releases these fibrous tissues and the skin pops up and voila, the dimple is gone. So let me just keep going here. And so what Cellfina is, it's minimally invasive. So we do this all under local anesthesia without any oral sedation, without any operating room. It takes around an hour, hour and 15 minutes to do. You go home and you can go to work the next day. It's very effective. Patients are very satisfied and it's very long lasting. So let's keep going here. So as I discussed earlier, this is what the before looks like. And this is what the after looks like. With releasing those fibrous tissues, the skin pops up. So let's go over. It's a single office procedure, rapid improvement. You see results that start around 3 days, and they continue to get better. Very limited downtime. For the first 24 or 36 hours, there's a little bit of drainage that you put on gauze to capture that. But after that, you're allowed to do minimal physical activity at about day 3. And about day 7, you could do light jogging. So very little downtime. 96% satisfaction rate at 2 years. So here are some of the results. And what you're looking at are the dimples on the buttocks and posterior thigh. That's what it treats. And you can see that after 1 year, there's no dimples on these circled areas, and at 2 years the same. Okay, again, looking over here, the dimples are much improved after 1 year, and after 2 years, they're the same or better. And this person even gained 5 pounds. So we don't recommend gaining weight, but this just goes to show you that it even worked with people that had gained weight. So this is just another example here. And you see there are a lot of dimples in this example, and they're improved, okay? Are we going to completely resolve your cellulite? No. We're not going to resolve the cellulite that's associated with textural changes. And we can't treat the areas of the banana roll, which are the areas right below the buttocks, because we have found that the results aren't as good in that area and we don't recommend it. So we can't treat textural changes, we can't treat the anterior thigh, we can treat the posterior thigh and buttocks area very well. So before treatment, you need to stop taking anything that can cause bleeding. We go over with pictures the areas that you want to treat, and we mark them, and then you look at them, and we all agree on the areas to treat. During treatment, you'll feel a little numbing medication being injected. That has been discussed as being a 2 or 3 out of 10 as far as pain level goes, but it's very minimal. After the numbing injection is made, there is no discomfort at all. And none of our patients require pain medication afterwards or during the case. After treatment, you wear compression garments to hold the gauze in place and to keep the outcomes better. And we recommend using compression garments like Spanx or Lululemon yoga pants for about 2 weeks. So Cellfina is a great treatment to treat cellulite. Long-term results, very high satisfaction, minimal downtime, very little discomfort. Takes about an hour, hour and a half to do in the office. We do it under local anesthesia, no pain medication, no oral medication, no operating room. Long-term results on the cheek and posterior thigh cellulite dimples. So if you need any more information, give us a call at our office. Thank you, Dr. Steve Weiner.